You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome to the ATS Breathe Easy podcast. I'm your host, Dr. Erika Moseson, a pulmonary critical care medicine physician in Oregon and host of the Air Health, Our Health podcast. Today, we are here to talk about non-smoking causes of COPD, and I'm delighted to be joined by Dr. Meilan K. Dr. K, why don't you introduce yourself?
All right, thanks so much, Erika. So my name is Meilan K. I am a pulmonologist at the University of Michigan. I'm chief of pulmonary critical care there. And I'm also, I guess, relevant to this podcast, a member of the GOLD committee that writes a lot of the international recommendations on diagnosis and treatment of COPD.
And thank you very much for doing that. I know it's a mainstay of those of us working in clinic. So we often think about cigarette smoking causing COPD, but we're here today to talk about other things besides cigarettes that can do that. So what are the main environmental or behavioral causes of COPD besides cigarette smoking, and how do they vary, here and around the world?
So the estimates really vary, I think, depending on the literature you look at. I think one of the numbers I always remember is roughly 25% of COPD is not related to personal cigarette smoking. I think one of the challenges, though, is when I think about the number and then I think about my own clinic, those numbers don't always match up. And then I wonder how many of those patients are just sitting out there not diagnosed. So I always wonder about that a little bit. But I think that there are many, many things that likely contribute to non-smoking related COPD. And they range from factors of prematurity, respiratory distress in infancy, recurrent respiratory infections during childhood, could be maternal smoking, family, poor air quality in the home. One of the things that we talk about a lot from a global health perspective are biomass fuel associated COPD. And I think one of the eye-opener moments I had about that a few years ago was when I was reading, there's a paper from CanCold that talks about, was looking at risk factors for COPD, and they actually identified biomass exposure as being a risk factor for development of COPD, particularly in women in Canada. And I remember thinking about the paper because we associate that with, I think, people cooking over in either, poorly ventilated areas in parts of the world like India or China or Africa or, open flames or that sort of thing. But so I was very confused when I read this paper from Canada, and so I remember chatting with a few of the authors about it, and they said, "Oh, it's Meilan, this is all from wood burning stoves in people's homes," and I was like, "Oh," which that really varies. I think depending on where you are in the country, but I grew up in Idaho, and I had a wood burning stove in our house growing up, where I'm going to call maybe emerging threats. Also include things like climate change, air pollution. I think we knew for a long time that air pollution contributes to exacerbations of COPD and asthma, but now there's data to suggest it can actually be causative for those conditions. And then I think, the other question I think is sort of out there as well is, what is the contribution of vaping? And to what extent is that going to be a major cause for COPD in the future? I think there's definitely concerns. We don't have a lot of that long-term data yet, but so I guess to answer your question, the list is really long.
Absolutely. It's interesting. I see a similar thing out where I am because I live in Oregon, and, electricity and even, gas to heat homes can be very expensive, but we got trees everywhere. So there's a lot of people lighting fires inside their house. And, the tagline of my other podcast is, "Don't light things on fire and breathe them into your lungs." So basically everything that we can light on fire, from biomass to cigarettes to wood in the house to the air pollution and diesel fuel outside, I think we worry about causing obstructive lung disease. And then you touched briefly on genetic or birth factors that can cause COPD. I think we think of alpha-1 antitrypsin and prematurity. Are there other things we should be thinking about when we're interviewing a patient who hasn't smoked but is seeming to have obstructive lung disease on their PFTs?
Yeah, the one other thing I forgot to mention but is obvious, is asthma. So I think that's where it gets kind of confusing when a patient starts out with asthma and then they develop um, more permanent or fixed airflow obstruction. And now that we're recognizing more type 2 inflammation in COPD, it starts to get very gray. But you do raise a good point in terms of the history. So in my own clinic, I do start every new patient uh, questionnaire or sort of history with birth history. There's actually some interesting data that I came across that suggests that maternal smoking during pregnancy, and it's actually the nicotine itself. So if they were, for instance, to replace it with e-cigarettes, that doesn't necessarily get around that problem. But that nicotine exposure itself actually can contribute to the development of long and tortuous airways in the infant. And then there's actually some other data to suggest that that can be mitigated with vitamin C, interestingly. So that's a little bit of a detour, but I'll start with that. I'll ask about, prematurity. I'll ask about any respiratory um, uh, issues during childhood, frequent infections, pneumonias, asthma. And so I'll just try to kind of go throughout. And then also, I think the attributable risk is somewhere between 10 and 15%, but jobs that people have in adulthood, a few years ago, it's not COPD, but a few years ago, there was increased awareness over silica exposure in California, and how a lot there, several workers actually developed respiratory failure. So, but I think there's probably a lot of other factors in the home or at work that we don't often ask about, and probably are not studied as well as they should be. But so I do try to ask about, okay, what do you do for a living, and just try to get a sense for the different kinds of jobs people have had and what the kinds of exposures, as well as a little bit more about living conditions in the home. Do they live in a like a multifamily housing unit where they maybe could, be getting exposed to cigarette smoke that way, et cetera. So a lot of, potential places where people could be exposed to things that could be harmful for their lungs.
Absolutely. Are there common features that characterize the clinical course of COPD in non-smokers versus smokers?
So that's a good question. There's the data that's out there suggests that non-smoking COPD, and some of this data comes from places like China and Mexico, where it's probably more, for instance, more biomass exposure related, suggests that the phenotype may be more airway centric and that there may be less emphysema. Now, whether that uh, is associated with a difference, for instance, the next obvious question would be, does that mean you should be treating these patients differently? We just don't have a lot of data on that, because if you look at all of the clinical trials for pretty much all the drugs that we use in COPD, the FDA pretty much requires that they be done in patients with, 10-pack years smoking history. That's the inclusion criteria for almost all of these studies. So we don't have the answer to that, because nobody's done those studies. And to be honest, I've thought about it because one of the other hats I wear is as a physician scientist and a clinical researcher. Trying to put a group of patients like this together for a clinical trial is really challenging, because I think a lot of times they don't come to clear attention in the healthcare system, or they get labeled as something else. So I think it's data I would love to have, but I think getting it would be really hard.
Well, touching on that, so you mentioned serving on the GOLD guidelines committee. So I imagine GOLD doesn't distinguish in its guidelines for managing COPD in non-smokers from smokers.
No, they don't really, because we just don't have data.
Yeah. And often these things overlap, right? You grow up in a home with a mom who smokes, and then you become a smoker, and
Right.
also you're burning wood, and it's hard to tease out what exactly caused what.
Clinicians, want to feel more confident caring for patients with serious illness? The American Thoracic Society and the Center to Advance Palliative Care have teamed up to bring you a brand new 7-course CME series on ATS Ed Plus. You'll learn practical, real-world skills in palliative care basics, symptom management, and communication for tough conversations. All designed to help you make a difference at the bedside. And the best part? You'll earn CME credit as you learn. Find the full series on atsedplus.thoracic.org.
So our clinicians are often short on time, but want to provide patients with resources. So where do you direct patients for more information on living with COPD, or where do you recommend people send folks to kind of help them stay healthy and get more information when they're not in the clinic setting?
I think there's a lot of different resources, both for patients and physicians. So I'll just mention some of my favorites. The COPD Foundation, for one, has a lot of great patient ed, as does the American Thoracic Society and American Lung Association. All have good, I think, patient resources, are all places to look. Gold also has information, although I think Gold's information is probably a little bit more physician-centric than it is patient-centric. The other place that I'll point both clinicians and patients to is Up to Date. So I think clinicians know and are very familiar with that as a resource. It does get updated more often than Gold. We do Gold once a year, but Up to Date really is up to date. But people may not know that Up to Date also has some patient ed sections, which actually I know about because I helped to edit some of them. And so we try to keep those updated for patients, and that's free, right? So the physician stuff's behind the firewall, but the patient ed stuff for Up to Date's free. So those are all some, I think, various places that patients and providers can get more information about COPD.
And then one of the things I often think about with COPD is often these are things that are done to people just from the air they breathe. They develop these illnesses, especially in the non-smoking context. So what steps can communities take to decrease the burden of COPD, especially, non-smoking COPD, and also make living with COPD easier?
Yeah, there's like so much in that we could spend like the next 5 days on that topic. But so when it comes to tobacco, right? So a lot of things have already been put in place to limit tobacco in like bars and restaurants and things like that from just like a policy perspective. I actually went to the city. I live in Ann Arbor. I actually testified a few years ago. It's the first and only time I've done this at a city hearing. They were talking about moving the age limit for purchasing tobacco. And I think one of the important things to remember that pulmonary physicians know is that lungs don't really reach maturity until you're about 25. So, so that's something to think about, as well as trying to keep that out of people's hands as long as possible. Okay, but that's the tobacco stuff. We're here to talk about non-tobacco. So non-tobacco, that's things like clean air, right? So anything we can do. And certainly I'm worried about the EPA currently from a national perspective, right? But a lot of the laws and protections that were put into place 20 and 30 years ago now really did make a big difference in cleaning up our air. And it's really important that we maintain or even further improve those protections. And then there's also like smaller policy things sort of on a city level. So for instance, limiting smoking in multi-family housing units. There's even some data it's hard to maybe fully make the line to COPD, but it does impact respiratory health for children. So I'm going to raise it. There's data to suggest that when, for instance, schools are near busy traffic areas, those children experience worse lung function, more wheezing episodes. And when children are moved away from that environment, that all gets better. So that kind of impacts stuff like where you build schools. You don't want them necessarily near high traffic zones. It impacts things like some schools. I think there's some information on the EPA website, definitely I think on the American Lung Association website, on like having schools adopt anti-idling policies. So those are a lot of different things, and they just touch the surface. But vaccinations, breastfeeding, promoting breastfeeding in moms, again, can promote healthier lungs and reduce the risk of respiratory infections. I think as an adult pulmonologist, I often forget that in children worldwide, pneumonia is like one of the leading causes of death in children, not to mention the fact that actually there's some super interesting data that Vija Vizisha has that I just saw coming out of her Beacon cohort. So the Beacon cohort is a young group of individuals in the UK. Okay, granted, they are, I know we're talking about not smoking COPD today, but it's a little bit hard for me to separate them. But
well, I think that's the reality of the world. These things are hard to separate, right? I'll see someone in clinic who smoked a few pack cigarettes in college and they say they're there with their COPD from that. And I'm saying, I think maybe it's the long lifetime of diesel trucking that is getting you here.
Yeah. So these individuals all have a little bit of a smoking history, but they're pretty young. So not like a huge smoking history. But what she found was that both upper and lower respiratory tract infections, like things that we might call a cold, were associated with more rapid lung function decline. And even in young individuals. And so it just, to me, the other kind of loop that keeps playing in my head is I keep thinking about during the pandemic when all of us were a lot more careful, a lot of people were masks, and in particular, our patients with COPD were all being very, very careful. And we really saw exacerbation rates plummet. And
so many of my patients said it was their best year ever.
My son,
they were just not in the hospital, having a great time. And it really makes you think about that burden of infection.
Yeah, my son who has, it's probably asthma, but I won't call it that. I'm going to call it reactive airways disease. But he gets the fall wheezing episodes with these infections, and then has to go on inhalers. And even he had the best 2 years breathing wise of his life. When we think about how do we, protect the lungs and try to reduce the risk of developing airflow obstruction, I think we underestimate the role of respiratory infections, and particularly viruses, really throughout the lifespan.
Well, and I think it's a challenge because a lot of these things influence each other, right? So we know that inhaling particulate matter and smoke and air pollution changes the immune system of the lung. Even after wildfire events go through, the following flu season can be more severe, right? So then that increases your risk of infection. And then you can kind of be off to the races with a vortex of illness, I guess, as they say.
Yeah. Well, to me, the most interesting data that came out of the pandemic was that study. I think it was some Harvard researchers, but they looked at COVID infections in Oregon during the summer of 2020 when there were wildfires, and they found more COVID infections and more COVID deaths. And that relationship between air pollution and infections had previously been reported, but we've never been tracking the infections at the level that we were tracking them during the pandemic. And so you could really see, okay, we have this exposure in this spot, and I can tell you exactly how many more infections and deaths we had related to that exposure. And that really kind of just hit me that we're all probably walking around with these insults all the time, but we don't really know the damage that they've done unless you're sort of in this kind of situation where your lungs are getting extra stress. And then it also really kind of made me wonder, I realize we're kind of going off topic here, but it also made me think about how we saw such variation in COVID related complications during the pandemic, and why some patients who we thought were pretty healthy, why did they have such a horrible course? And then this other patient who had chronic lung disease did great. And I think it's probably not all of it. I'm sure it's differences in immune system, things like that. But I do wonder whether underlying lung inflammation from, that you just didn't know you had from some exposure from work or the home that you didn't know you were getting, modulated the severity of illness that we saw during the pandemic.
Absolutely. Well, I think our main take homes here are to have less things on fire in our communities, whether they're cigarette butts or forests or diesel fuel or indoor, dirty air, and hope we can get pregnancies to full term, and then try to keep the air clean and people vaccinated to try to do the best by our COPD patients. And then for treatment, we just follow the beautiful GOLD guidelines, which I think you have participated in making. So thank you for your service.
Well, thanks, Erika and ATS, for highlighting this during COPD Awareness Month. So thank you. Just one of the things that this conversation reminds me of is just how that all the stuff that we talked about today, I probably don't talk to my patients about it enough, right? And B, how little I think government, policymakers, insurers, people in charge, probably really understand about this. So it's great that we have probably ATS members listening to the podcast about this, but this is the kind of thing that really needs to get outside of the ATS community if we're really going to try to, prevent COPD for the next generation.
Absolutely.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.